Greetings of the season. I am Dr. Vijay Varat. I am a pediatrician, allergist and clinical immunologist looking towards the family allergies, even adults also. Practicing at Sai Allergy, Asthma, Children's Hospital, Pune. Last few decades, the allergy has been the #1 chronic disease in children. Even in adults, every third person is suffering with some or the other allergy. Even most of the medicines consumed from the counters, from the medical stores, are anti-allergic medications. Only thing is that still in India, the first generation antihistamines are so much used, they have a lot of side effects. Even in children below 12 years, US FDA, it has not approved those first generation antihistamines. But in India, they are overused. They cause a sedation, the sleep cycle in children is affected. It causes a cognitive and behavioral disturbances in the children. Specifically in adults also, the work in the offices, schools, or in day-to-day life also. The patient is drowsy, he feels sluggish, not able to work that effectively. So considering over-the-counter availability of these first generation sedative antihistamines in India, it is a very large, it is a very important problem. So most important is the safer antihistamines. So second generation antihistamines. In that, the belasting has been now in India since few years, and practically in children's it is very useful. I have used thousands of patients and there is no cognitive behavioral disturbances. It is very efficacious also as a antihistamine, as well as it has a good anti-inflammatory action, so that the mast cells also get very well controlled. And for the very good control of rhinitis, rhinoconjunctivitis, even the skin allergies, urticarias, or even in the atopic dermatitis, eczema, the itch is reduced very well. And the good part is that it can be increased, the dose can be increased even in adults up to 80 mg. So it is very useful in clinical practice. It doesn't interfere with the renal or liver, anything. It does not have a blood-brain barrier crossing, so that it has only the peripheral receptor actions. So the patient doesn't have any drowsiness, no